Hello, welcome to Nurse Linda's video blog this week. Requested topic of discussion for this week is immunology. Immunology is so complicated. I most certainly don't understand most of it, but there are lots of challenges that my patients have in this whole immunology arena. So certainly there's a discussion that I have, and over the years have kind of figured out in my silly little analogy ways to try to describe things and help people understand things. And quite honestly, it's what I have to do on difficult topics like this to try to make me understand it too, as well as to try to explain it to people. Because again, as usual, you know, I'm a big believer in if you're empowered to understand things, certainly mostly what we fear in life is we fear what we don't understand, and there are lots of like tangents you can go off on immunology that are scary to people. So let me give you the my explanation and what I discuss with people regarding immunology. Now, what I'm not doing is I'm not diagnosing anybody. I'm not explaining exactly on the cellular level how immunology treatment works. Heck, I don't even understand exactly how it works. I don't know that anybody actually understands exactly how it works. But what I want to start out with is just that terrible place that people are in when they are often told by very respectable physicians at other clinics, just poo-pooing the whole immunology thing. Don't worry about it. That's a bunch of bunk. It's not proven. There isn't anything to that. And, there have been times in the past where I kind of wonder, boy, life would be really easy if I worked for those kind of clinics and I could just tell people that because you'd be done with the topic. But, of course, that's not the case. And it's hard in almost, so many aspects of IVF. There are different doctor opinions, and good qualified doctors. And here's the poor patient, who is the least qualified of everybody, trying to make some kind of, executive decision about where they're supposed to go for treatment, and spend a lot of money and devote all of this, psychological and emotional and money, on getting treatment. And they're not qualified, at least certainly when it comes to medical aspects like this. So, of course, what I always tell my patients is try to learn, as much as you can about something. Try to understand it as best you can so that you can make, and I'm going to say an educational decision, but honestly, I probably go a lot more with like what your gut tells you, what are your instincts about something, what makes sense to you. Now, when it comes to this whole immunology thing, for as long as I've been with Dr. Sher for 15 years, and for 15 years this has been part of my life. He is, like the grandfather of immunology. He's been doing it longer than probably anybody has been doing it out there. And, one thing I always have to, make sure my patients understand, and my patients tend to they travel from all over the world, and they're coming, they don't tend to be newbies deciding to travel. They tend to be very experienced patients having failed cycles elsewhere, and they're just looking for something different, something, I don't want to do the same thing over and over again. So they're enticed by this idea of, let's look at other things. And I explained to them that, as we talk about immunology, I want you to know it's because this is really what we believe can have an impact on things. I don't run the tests. I don't make any money on running the tests. I rarely actually even infuse intralipids in my clinic. What do I get out of this? What do I get out of immunology testing? Except for that we really just believe in it, and that's the truth. There is no sideways reason as to why we would go down this route, except for that we really believe in it. Now again, doctors are going to tell you, well, there's no controlled studies on this, and that's true, and that's actually something very difficult. It's always something we're working on, but it's something very difficult to try to get. In IVF, to try to do controlled studies, on whatever topic you want is difficult because so many factors impact IVF success. Like I said, we've tried to do these studies, but in an informal way, here's what we have learned. And patients are their own control. we get hundreds and hundreds of patients that come from other clinics where they were told they've had good blastocysts, and of course these are clinics that don't dabble in immunology, etc. And they don't get pregnant, or they miscarry. And then we treat them here. We invariably find something wrong in their immune workup, do the treatment, and lo and behold, not only do they get pregnant, but they have a baby. Have seen that so many times. And again, I like that because it's not a formal study, but that's the same gal. That's her same body. That's her same uterus. That's her same lining. That's her same eggs. You know, she makes a nice control for herself with treatment, without treatment. And we've seen that repeatedly over and over, so that I know in my heart that there is something to this whole immunology thing. So know this, that certainly just from an immunological point of view, your immune system absolutely is the guard for everything entering our body. Of course, most of our immune system, you enter somehow through the gut, etc. But nonetheless, our immune system is on alert for everything. To look at, and probably the most popular thing to look at, is natural killer cells. Now, this is my, simple nurse way of explaining to patients when they're diagnosed with natural killer cell or elevated natural killer cell activity, what exactly does this mean? Even more important, what doesn't it mean? Natural killer cells are good things. We all have them. We better have them. It is what keeps us healthy. It's what helps fight off, the bad guys out there in the world. So I'm not finding you have natural killer cells. What did somebody once say? One patient once told me, I'm a natural-born killer, and I have a natural-born killer in my body. And it sounded like this, awful thing. And so again, people misunderstand when they're told they have natural killer cells, like, oh, I shouldn't have those. No, that's a good thing. We all have them. What we're looking at is we're looking to see if you have an elevated level, if you have a higher activity level on natural killer cells. Now, when I have patients who find that they do, what does this mean? Well, one, it probably means, I bet, you're pretty darn healthy. It means you've got this, I call it the more aggressive immune system, and for my patients out there, I have my silly little analogies, but I call it the Rottweiler immune system. It's on guard, big time. And again, you're otherwise probably a pretty healthy person. You notice the people around you might get sick, something's always going around, but you actually, you might only get a smidge of it, or you don't get anything at all. So again, that's not a bad thing. So to have these elevated natural killer cells in real life is not something that's dangerous or worrisome or anything like that. It's actually probably, doing right by you. The problem is again, like with a Rottweiler, sometimes that Rottweiler will turn around and bite the hand that feeds it. In other words, it just does too much. And of course, we know that certainly it's a fact, there are diseases out there, that are immunologically based, rheumatoid arthritis, lupus, thyroid disease. These are all examples. Now we're thinking a lot of GI stuff, Crohn's disease, all this kind of stuff is based in, for some reason, your own immune system is attacking parts of your body. Again, just wildly, overactive. I mean, a Rottweiler. Why would a dog attack its owner when that's who feeds it? Because this is the nature of that beast. And again, please, I'm not picking on Rottweilers. I had one. I love them. But I'm saying I'm using that just as a metaphor. So this immune system is, again, hyperactive. It's always looking out for things. Now, what happens when an embryo is transferred into your body? That embryo is half your partner's. So there's a component to this embryo that is foreign to you. Again, these are facts. What happens when something foreign enters our body? Who's right there to check that out? Our immune system. Again, if you have a normal, relaxed immune system, well, it's probably not going to be a problem. If you got that, hyperactive immune system, always looking to protect you, overprotect you, you may have a problem. So that's kind of what elevated natural killer cell activity is my way for you to look at it. I don't want you to see this as something that is bad, is something that's going to lead to autoimmune diseases. Now, oftentimes, When we're looking for natural killer cells, we're looking at other things too. People might have thyroid issues. Again, if you come here and I find out you're hypothyroid and you're on thyroid replacement medications, more than likely you have anti-thyroid antibodies. Again, your immune system goes and makes antibodies against your poor little thyroid as if, he was some bad guy to you. That by definition right there is an overactive immune system. One of the first things I'm going to do on that gal is I'm going to check out what her natural killer cell activity is. Not that the anti-thyroid antibodies in themselves bother me for your pregnancy, but it's representative of immune system that might bother me. Endometriosis is another condition where, again, your body's constantly trying to clean up this endometriosis, and again, has that caused an immune system to go into overdrive? So there certainly are some red flags out there that make us look into immunology. So again, don't be afraid if you've got this natural killer cell diagnosis. Now, what are you going to do about it? Well, the bottom line is we're not going to do anything about your immune system. That's another element. People get very concerned or worried that I'm going to try to alter their immune system. I'm going to lower, their immune system such that I had one gal I just spoke to recently who has breast cancer that runs in her family, and she said, I'm afraid if I do something to lower my immune system that cancer cells may take over. I mean, this is like scary stuff. This was a real fear of hers, and I told her, I explained to her, listen, I am not. People who have their immune systems, really have their immune system decreased, think about it, people who have organ transplants, you need to really reduce the level of their immune system. You immunosuppress them. You have to take some serious drugs to do that. Really, some really serious drugs to do that. And because you need to in order to allow organs to, be accepted by the body, etc. So there are serious medications one takes to immunosuppress themselves. We are not giving you something that immunosuppresses you. Intralipids right now, thank goodness, is the treatment of choice. It used to be, back in the old days, when I say old days, I don't know, almost 10 years now, we used to have to do a blood product called IVIG. Just enough to say, thank goodness we don't have to do that anymore. Intralipids. Intralipids is the treatment of choice for natural killer cells. Intralipids is I tell my patients, like a super nutritional supplement. It's actually in the hospitals for you nurses out there will know, it's TPN, total parenteral nutrition. It kind of looks like a milky substance, and it's given through an IV or a central line, and it supplies nutrition to people who for whatever reason can't use their GI for nutrition. And it's just, a bunch of essential fatty acids, and it's soy product and egg product, and again, it's just really a big, nutritional supplement. That's what intralipids is. Of course, we give you a very small dose of it, and it's a diluted dose of it. And as long as you're not allergic to soy or eggs, it is an absolutely completely benign infusion. The side effects, again, I can't even think of any side effects that my patients have ever had with that. Now, how exactly intralipids works, again, nobody exactly knows. They've got some theories and ideas. Basically, it's helping protect those embryos against your immune system. Often I have patients ask me, well, geez, okay, so I've got the natural killer cells, I did the intralipids, don't you think I should check the natural killer cells again? No. You know what? You already showed they're activated. We know that about you. Now, all right, what if I retested them and they were, 6 months later I tested them again and they were normal? Would I not give you intralipid in an IVF cycle? No, I absolutely would. Why? Because your body has shown me that it's been like that in the past. So I know you're like that. I know you've got the ability to flare up, if you will. And we all know this. We all know our immune system changes. It varies depending on what's going on in our life. It depends on, how otherwise healthy am I? How am I eating? How am I sleeping? What's the stress level like, etc. So we all know that our immune systems vary. So it is true, immune systems do vary. But again, what if I again, somebody might say, well, what if I do the intralipids and you should test the natural killer cells? Maybe they're still activated. Well, they are activated. We already know this about you. The intralipids isn't altering that as much as it's protecting the embryos that we put back. I had a husband once, God love those men. He said to me, I'm trying to explain this to them. It was actually back in the day when we did IVIG, and he was there with his wife when she was getting an IVIG infusion. And I'm kind of doing my little explanation, all that, and he said, so it's like you have a really strong offensive line, and in order to combat that fairly, you need a really strong defensive line. I was like, all right, yeah, that will work too. I like my dog. My dog is a little bit simpler, but that works too. And that's what it is. Intralipids is just extra protection against a stronger immune system. Again, no need to keep checking the natural killer cells. Even some people wonder, well, what if it's higher than it was? Your treatment is intralipids regardless. It's the same intralipids. I don't change the dose. Nothing about that changes. And I'm protecting the embryos anyway. Remember, I'm not treating the natural killer cell activity. So that's natural killer cells. And again, if you have that issue and you do the intralipids, I consider it a non-issue anymore. I don't see decreased pregnancy rates as long as you're doing intralipids, so it isn't a concern anymore. So that isn't anything for us to worry about. You'll do an infusion about within, I'm going to say, 10 to 12 days prior to an embryo transfer. And knock on wood, we find out you're pregnant, we're going to do another infusion within about a week of that second beta. Now, that is, of course, what you'll hear referred to as autoimmune issues. Autoimmune, they have to do with me. There's another arm of immunology called alloimmune. And for those of you who have gotten tested in this area, and certainly if you've consulted with Dr. Sher, or you're somebody who's had repeated miscarriages or repeated IVF failures for, not any real detectable reason, good embryos, etc., he's usually going to have you get some alloimmune testing done. And specifically what that involves is what is called DQ alpha and HLA blood work. Now, what this is alloimmune. This is looking at you and your partner. I'm going to get blood work drawn on both of you. And what we're looking at are specific immune genes. For example, we'll focus on just DQ alpha for a minute. DQ alpha is just a specific immune gene. You have two of them. You got one from your mom, you got one from your dad. These are numbers. They're reported as numbers. 2.1, 3.0, 4.0, 4.1, 1.0. They're just numbers. And I don't much care what the numbers are. When you get that blood work done, I'm going to get two numbers back on you, and I'm going to get two numbers back on your partner. What I don't want is I don't want any of those numbers to match. I don't want either of your two numbers to match those two numbers of your partner. If they do, and hopefully they only do on one number matches, then you have what's called a partial DQ alpha match, and you have an alloimmune issue. Now what that means, and this again, guess what it's all tied back to? It's tied back to that natural killer cell guy. Because these genes in themselves, these are just genes. They're not doing anything to make you or not make you get pregnant. It's what is going on in your body because of those genes. All right? So let's say you and your husband share a 3.0. And I should explain why is it not okay to share? And the philosophy is, Mother Nature wants people with two very different immune systems to get together and have a baby. So the baby has a very diversified immune system. Survival of the fittest kind of thing. So when a couple has this similarity, again, they're thought to have similar immune systems. And again, that can be a challenge. Now, again, most often you only see this partial DQ alpha match. Of course, there are times when you see a total DQ alpha match when, I'm a 1.0 and a 3.0 and so's my husband. That I'm going to put that aside because that's a real big challenge. Not to say, again, not saying in any of these situations people still don't get pregnant and have babies, but that one's much more challenging. But to stick with what is more commonly seen, and that's a partial DQ alpha. Now, what that means is, and again, we'll use the example, let's say I'm a 1.0 and a 3.0, and my husband's a 3.0 and a 4.0. Half of his sperm are going to contain the 3.0, and half of his sperm are going to contain the 4.0. Because his sperm have to divide his chromosomes in half, and theoretically, statistically, half of them go into, sperm over here, and this gene goes into this half. Now, half of the time, this isn't even going to be an issue. Because theoretically, half of the embryos he makes are going to be with that 4.0 sperm. That doesn't match my body. It's going to be no problem at all. Except, you know what? I don't know what sperm makes what embryo. There's no such test out there yet to figure that out. Now, half of his sperm, the 3.0, is going to match my body. And that's the part where my body's going to look at that. Not necessarily like that situation. And natural killer cells. Oh, here they come again. Natural killer cells are going to be the guys who are going to cause trouble. Now, if you don't have elevated natural killer cell activity going into this, at least the first transfer of embryos, probably not going to be a problem. I'm probably going to treat you like it could be, because I never know what's going on with those killer cells. But it's not as much of an issue. Usually, like allergy situations where you have to be exposed to something first to cause this, this immune response. And that when you get exposed the second time, boom, now you have the allergy. It's kind of like that. Once your body gets exposed to the embryos that match from your husband, you form natural killer cells anyway. Well, the treatment for this DQ alpha issue, which I cannot change, it's in the genes, is usually a stronger form of a steroid. And intralipids, the same in the beginning, 10 to 12 days before transfer, but I'm going to keep the intralipids going farther into the pregnancy, probably out to about 24 weeks of pregnancy. Because again, what we've seen is, people with a DQ alpha matching issue tend to have more miscarriages or chemical pregnancies, or again, just more IVF failures without explained reasons. And again, I never know which embryo we're putting in. One of the things Dr. Sher will do is he only likes to transfer one embryo at a time when you have a DQ alpha issue. And the reason is, again, strictly from a statistical point of view, if you made, let's say you made 2 blastocysts in a cycle, well, again, statistically, one is a match, one is not. If you put 2 embryos in, I'm putting one in that could be causing some trouble, along with potentially one that wouldn't cause any trouble at all. And, of course, nobody really knows what goes on there, but logically, it makes me a little worried. So you know how I avoid that? I just transfer one at a time. I transfer one at a time, and that way I don't ever have this mixing going on type thing. So that's also one of his suggested treatments when you have this DQ alpha issue. So DQ alpha is something that's definitely a little bit more of a challenge to overcome than just the natural killer cells. But I've seen so many babies born from that. Now, if you said, well, how would I ever fix that DQ alpha issue permanently? And the permanent fix to it is to change up one of the 2 elements. I change up the sperm, i.e. go get a sperm donor, or I change the uterus. Got to get a gestational carrier. Now some women say, I'm going the route of egg donor. So I guess that probably fixes it, and egg donor doesn't fix it. Egg donor doesn't fix it. It's the sperm component of the embryo being looked at by my uterus. So you've got to change one of those 2 components. So that's immunology. And I know sometimes my explanations get a little, silly and stuff that's very serious and, very complicated, but it's the way that in time I've learned, trying to dispel some fears and myths on a topic that is difficult to comprehend. Usually you've been told it's not an issue, don't even pay attention to those docs who do it. And again, we do it simply because, again, I get nothing out of it, except for that we really do believe it. So that's about as much as I guess I can say about immunology. Always, down below, you'll see a link to asknurselinda@haveababy.com. That's an email that comes directly to me. You're always welcome to email me any questions. As usual, always email me more topics and ideas of what you'd like to hear more about. And I will be back next week. Have a good night, guys. Bye.